If I was a patient in need of spine surgery, and I've had surgery at HSS for other reasons, but not on my back, the things that I think I would consider when choosing a surgeon are the surgeon's ability to understand what I'm complaining about, rather than just looking at an MRI and telling me what they think I need. And then really their understanding of what my treatment options are available to me, and then helping me work toward exhausting non-operative measures first, and then indicating a surgery that will give me the best chance for success with the least risk.
My ability to move was deteriorating by the day, and within 6 months' time, I could barely even walk. I was losing the feeling in my legs. Getting on and off was a problem. I couldn't feel my hands when I would ride. I just began to be in pain 24 hours a day. Traveling from Florida to New York was an absolute no-brainer. I wanted to go where I was confident in the doctors, confident in the hospital. Surgery is a big decision, so I'm gonna find the very best.
We staged separate procedures for both the lower back and the cervical spine such that we could get her back to her high level of performance.
By 8 weeks, like, life was really good. The neck, that was the easiest surgery going, and it was very successful. I can turn either way, up, down, and I don't feel a thing. I feel like I'm 20 again. My body it's kind of like my body got a reset.
Good morning, Chris. How are you?
Good, how are you?
Everything doing fine?
Great.
I started feeling what I felt was a muscle spasm in my shoulder blade on my left side.
He had a disc herniation at 2 levels, at C5-6 and C6-7. The decision made by Chris to go forward with surgery was heavily dependent on his disabling pain, in the sense that his difficulty with working, his inability to sleep, he was pretty distraught.
After looking into Dr. Rowland's history and training, I really felt confident that he was the right person for me.
Surgery went very well. He has excellent range of motion. I believe he went back to work in record time in 2 weeks.
Being a business owner, being a chef in the field I am, knowing that I would have to be out of commission and contained to my house for a long period of time was rather daunting. I absolutely feel I made the right decision in having surgery. It's definitely scary, but coming out of it afterwards and seeing what happened and the recovery and how incredible I feel, it's amazing that I had the kind of level of pain that I had, and now I feel normal. I feel 100% normal.
The importance of musculoskeletal health on the entire rest of the body and the entire rest of the human is so important, because if you're active and you're moving, your risk of cardiovascular problems goes down, lung problems goes down, your chances with cancer and things like that go way down the more physically active you are. I think the greatest success that we have is when we get the patient not only decrease their pain and back to life again, but get them excelling at it. It's one thing to live and it's another thing to thrive.
Success of my patients is the reason why I do what I do. It really gives me great fulfillment, and I feel a sense of gratitude when I can help improve someone's quality of life.